Good evening, everyone. Imagine having a medical emergency, a broken bone, deep cut, or a heart attack. But when you go to the hospital, you are told you'll have to wait for care for a day, a week, or even a month. That would be unacceptable, but that is exactly what is happening to thousands of people in desperate need of mental health care. Whether they end up in the emergency room or are looking for a therapist, they are facing a shortage of accessible and affordable care that is impacting all of us, especially our young people. We caution you that tonight's show deals with anxiety, depression, suicidal ideation, and other issues that may be difficult for some viewers.
I was also having some severe anxiety. I was having panic attacks like 10 times a day. Not able to breathe. I would often be in classrooms and I would be trying to silently have the panic attack and leave the classroom so then I didn't draw attention to myself. So it was definitely becoming unmanageable.
Unmanageable, intolerable, unrelenting. Sophie Calton was a high school senior when she had her first struggles with mental health, a situation that escalated quickly.
The depression just kept getting worse and worse. The panic disorder kept getting worse, and it got to the point where I was severely suicidal and I didn't know how to live anymore.
Sophie is not alone in her struggle. America is in the grips of a mental health crisis, and our children and young adults are especially hard hit.
The main areas where we're very concerned are significant increases in the rates of depression, anxiety, eating disorders, and even things like suicidal ideation, or kids and teens actually tried to harm themselves.
Nationally, 20% of children ages 3 to 17 will experience a mental health condition each year. From 2007 to 2018, before the pandemic, the suicide rate among 10 to 24-year-olds rose 60% in America. And Massachusetts is higher than the national average in childhood rates of anxiety, depression, alcohol use, and illicit drug use. The pandemic, school shootings, political and social unrest, climate change, war. The world often seems like a dangerous and unsettling place. Dr. Erica Lee is a psychologist at Boston Children's Hospital.
Kids just really are out in the world recognizing there's a lot less safety, and they're really not sure, where is the world going? Who do I look to be safe? Can I be safe in regular everyday places like school or at home or with my friends? All of this just really adds to kids' sense that I'm not quite sure what's happening in the world, and I'm not quite sure what's going to happen next.
Girls and young women are especially hard hit. By the time they reach their teen years, they are twice as likely as their male counterparts to experience anxiety and depression. Sophie Calton's struggles eventually led her to a hospital emergency room, crowded with people just like her.
I had like a one-on-one watchdog type of person, someone who was supposed to make sure I didn't hurt myself. And I noticed that almost the entire pediatric emergency room was psych patients. We all had to wear green scrubs so you could differentiate us. And we all were supposed to have one-on-one people, but there weren't enough, so sometimes it was one for 2 patients. And it just was very clear that the emergency room was completely overloaded.
It was 16 hours before she saw a social worker, 4 days before she was fortunate enough to get a bed at McLean Psychiatric Hospital. Many wait weeks or even months, kept in emergency rooms ill-equipped to deal with severe mental health conditions. It's a process known as boarding.
If I had diabetes or any other illness, they would not be leaving me in a bed untreated, because then I could get worse or at least stay the same. And that's the same with mental health. I was getting worse, or at the very least staying the same, because I wasn't getting any help. And I don't blame the healthcare workers who are doing their best. I blame a broken system. We definitely need more beds at mental hospitals. We need more social workers, more clinicians, just more of everything.
there are absolutely not enough programs for where we can send these kids to keep them safe. And really, if you think about it, if there's a certain number, say X number of psychologists or therapists or social workers or even psychiatrists in the country, the number who are actually specialized to treat children and adolescents goes down. And so there really just are not enough of us to meet the need. It really is tremendously heartbreaking for everyone.
Sophie spent 3 weeks at McLean, then more time in outpatient treatment. Eventually diagnosed with bipolar depression, medication and therapy have helped her tremendously. Now a sophomore at Simmons University, she is interested in journalism and is already broadcasting a message to her peers.
Reach out to anyone who will listen, because you may not want to live today, but you're going to thank yourself in tomorrow or in 10 years when you did keep going, because you have literally no idea what your life is going to bring you if you just keep fighting and keep living it.
The statistics we gave on the mental health crisis are all pre-pandemic, and as you might expect, early studies indicate the situation has only been exacerbated by the pandemic. And we discussed access in this segment, but the other barrier to care is affordability. Many providers don't even take insurance because people are willing to pay more out of pocket just to get care. That can lead to economic and racial inequities that only make the situation worse. Still to come, a shortage of providers.
There's no way that the patient is getting the support that they need when her caseload is more than triple what it should be.